Welcome to This Month in Type 1 Research. Please check the description for the original sources, and all content is general in nature and should not be considered medical advice.
So let's just jump right in and start with why we even do this explainer in the first place. This chart, well, it says it all. The amount of research into type 1 diabetes is just absolutely exploding. If you go back about 40 years to 1985, we were seeing around 1,200 publications a year. 20 years later, that number had doubled. And today, we're looking at over 4,600 new papers every single year. It's just impossible for any one person to keep up. So that's what we're here for, to break down some of the most interesting findings for you. All right, here's our roadmap for today. We're going to start really small, microscopic, looking at some clues at the cellular level. Then we'll zoom out and talk about new ways of thinking about complications. From there, we'll get into the human side of T1D, which is so important. And we'll wrap it all up with a look at some cool new tech before we boil it all down to your key takeaways. Okay, first up, we're going deep inside the body. We're going to look at two really fascinating new studies that are giving us some fundamental clues about how type 1 diabetes actually works on a cellular level. Now, to get our heads around this first study, we need to talk about a process called ferroptosis. I know it sounds super complex, but the idea is actually pretty straightforward. It's a specific way that cells can, self-destruct when they get overloaded with iron. You can think of it like a very specific, controlled demolition inside the cell. And what scientists are finding is that this process seems to be a key player in the organ damage that can happen with diabetes. So a recent study in diabetic mice uncovered something really interesting about this ferroptosis. They saw that in the early stages of diabetes, iron was building up in both the liver and the kidneys. But here's the kicker. It was really the kidney cells that were highly susceptible to damage from this iron-driven self-destruction. This is huge because it helps pinpoint the kidneys as a major area of vulnerability and maybe, just maybe, gives us a new target for therapies designed to protect them. All right, let's switch gears for a second and talk about vitamin D. For a long time, researchers have really just focused on the total amount of vitamin D a person has. But a new study is suggesting that's maybe only half the picture. They're looking at something called the vitamin D metabolite ratio, or VMR. This is a much better way to see how well your body's actually using the vitamin D it has. It's kind of like the difference between knowing how much gas is in the tank versus knowing how efficiently the engine is burning that gas. And this quote from this study really gets to the heart of it. What the researchers found was that a higher VMR, meaning the body was processing vitamin D more efficiently, was actually linked to protection against progressing from autoimmunity to a full T1D diagnosis. The thinking is that when your body uses vitamin D well, it helps quiet down the inflammatory pathways that are driving that autoimmune attack in the first place. So now let's try to connect these tiny discoveries at the cellular level to the much bigger picture of managing long-term health. We're starting to see a real shift towards tools that are more predictive and personalized, and there's a fantastic example of this in a new approach to diabetic kidney disease. So what's with the number 21 just sitting here? I promise it's not random. It actually represents a really important breakthrough in our ability to predict one of the most serious complications of T1D. This is what it's all about, the Jocelyn Kidney Panel. Researchers have zeroed in on a specific group of 21 proteins that, when you measure them in the blood, give a much more sophisticated and detailed picture of someone's individual risk for progressing to end-stage kidney disease. It's a huge leap beyond the standard tests we've been using for years. And this is where the real power of a tool like this comes into play. See, it's not just about flagging who's at risk. The goal is to create a personalized profile that can help doctors predict how a person might respond to certain kidney protective drugs. This is exactly what we mean when we talk about precision medicine, moving away from a one-size-fits-all approach to treatments that are truly tailored to you. Of course, T1D isn't just about cells and proteins. It's about people. It's about managing a really complex condition day in and day out. So this next section is all about the lived experience and how critical the support systems are for people with diabetes. A new study looked at the caregivers of kids who were newly diagnosed, focusing on their health literacy, which is basically their ability to find, understand, and use health information. And the good news is, the vast majority, over 92%, had adequate literacy. But that leaves this small but really significant group, almost 8%, who had some level of limitation. And this is where you see the real-world impact of that. The finding was pretty stark. Caregivers in that group with the highest likelihood of limited literacy were 75% less likely to have their child on a CGM within that critical first year. That's not just a statistic.
That is a massive barrier to getting access to a technology that can completely change a child's health outcome.
And the impact didn't stop there. This same group was also more likely to need an interpreter, they needed different types of diabetes education, and their kids tended to have longer hospital stays when they were first diagnosed. What this research does so well is it clearly identifies a group of people that really need a different, more tailored kind of support, right from day one, to make sure they have an equal shot at success. Okay, now let's pivot and look at the cutting edge. Let's talk about how new tech and tools are getting ready to reshape the T1D landscape, starting with a problem that is way too common. So here's the scenario. An adult starts developing type 1 diabetes, but because of their age, they're mistakenly told they have type 2. It happens all the time, and it can cause serious delays in getting on insulin. So the really big question is, can technology help us fix this problem on a huge scale? Well, it turns out the answer is a pretty resounding yes. Researchers used a machine learning model, a type of AI, and they let it loose on a massive database of real-world health records. The AI was able to scan through all that data and successfully flag people who were coded as having type 2, but whose clinical data really screamed type 1. It's an amazing application of this technology. All right, we've gone on quite a journey, from individual cells to kidney complications to artificial intelligence. So let's take a step back and pull it all together. What are the big themes we've seen this month? So, what are the big ideas to walk away with? First, the science is going deeper than ever, uncovering these fundamental mechanisms like ferroptosis that could lead to totally new treatments. Second, the power to predict the future is getting better, with tools like that 21 protein panel giving us a personalized glimpse at complication risk. Third, we're reminded that the human factor is everything. Things like health literacy can determine whether or not amazing technology actually gets used. And finally, AI is no longer science fiction. It's here, and it's becoming a practical tool that can help us solve real-world problems like misdiagnosis. You know, the one common thread that runs through everything we've talked about today is this powerful move toward personalization. We're getting further and further away from one-size-fits-all care. And that leaves us with one final question to think about. As all this research gets more and more precise, how is your T1D care going to become more personal? What does that future look like for you? Remember to like and subscribe, follow the link in the channel description to buy me a coffee, and thank you for listening.